Go ahead, go now in the neck. They going through all. What you said that was? Squirrel.
Squirrel.
No, I'm just joking. Robbie don't be lying to me, man. You know them Haitians be saying anything. Look at that. This Haitian say anything. He said this was squirrel. This is shrimp. You can't take Robbie Joe nowhere. Hold up, before you say anything, first I'll tell him what your name is.
All right. Hey, everybody. I'm nurse practitioner Dr. Katina. I am located in Margate. I have a medical practice. I am here for you. I'm focused on primary care, gynecology, teen, sexual health, and mental health.
What do you think? Because you said so many great things. I feel like you should write like a sex Bible.
I got my book here.
Yeah, show them that.
Let's talk sex and STDs.
Right. But what really hit is these teenagers, right?
Yes.
What do you think for this new age and this new generation, what can we do to get rid of what we just spoke about as far as like not having that communication going on? What can we do to change it like right now if you were to get some advice? Because you got a lot of experience in that department with dealing with teenagers.
Yes.
Because us parents, somehow we think we doing so good, but we kind of failing, but she isn't. So these kids are coming to you.
Yes.
So we need us parents, I'm speaking on all behalf of all the parents, what can we do? Or what are we doing wrong in order to get through to them?
Be there for your kid, okay? Be there meaning if you notice something, or even before you notice anything, take them to their healthcare provider, all right? Bring them in, let them have that conversation with them. Because I can tell you now, they come into my office and they'll tell me some things that they have never told anybody. So, and I take that time out to educate them and to provide them with the necessary tools. We have to stop shying away from talking about sex in our community, because that's when STDs run rampant in our community, because we're not talking about it. That's when you get these teenagers using Plan B or getting, abortion after abortion because you're scared to put them on birth control. Or you're scared to give them a condom. I have virgins that have genital warts. And people are like, how do you have genital warts when you're a virgin? And I say, because that's the lack of education. Genital warts is passed on skin-to-skin contact. So when they're bumping it, we call it the bumping and grinding back in my days. Right. So when you're bumping and grinding without clothes and the penis hit the vagina, or the vagina has warts, or the penis has warts, and you're just touching down there, guess what? You now have genital warts as a virgin. You've never had any type of penetration, so just skin-to-skin. So education is key. That's why you got to get my book to educate. All right, stay off Google. It'll give you the wrong information. And even if you don't get my book, just take them to someone, to talk to educate that they connect with. All right, so not all doctors, are good with teenagers or adolescents or preteens. So
you're a comfortable person to talk to.
Yes.
I feel like I want to share something with you, but I ain't got nothing to share. I ain't got nothing to share with her, but I felt so comfortable. I came up here guarded. She got me using lube on my hands. Look, tell them about this lube right quick.
Yeah, so this is Sex Stevia.
Right.
So you got the water-based lube and you got the oil-based lube. This is the one you can't use with condoms. This is for my postmenopausal patients. Right. Here we go, if you suffer from vaginal dryness. And then we have the water-based. This is my top seller. This can be used with and without condoms and be good for anal and vaginal sex. So whatever whatever rocks your boat.
Ain't no wrong hole. No, I'm just talking about listen.
A little bit goes a long way.
Right.
And this aligns with the vaginal pH. This is the most important part. So if you're using KY Jelly, Astroglide, you need to use mine.
And please, respectfully, not to cut you off, because that is a topic that's important. Sometimes, us men, we forget that, we just in and out. But some things stay with a woman, like throwing off her pH balance. I know it's about your diet. I know it's about your hygiene. But a lot of them things that you're putting inside of a woman can throw her off, and she has to stick with that.
Yes.
So that's important that you said that.
You got it. And on my page, if you follow me on Instagram at drkatina_Dr. K, I talk about men's sexual tips as well. So I always encourage everybody to do the tongue check. So just stick out your tongue, and if you can do it, if you now if you're listening, stick out your tongue, look at your tongue. If it's really white coated, then you may have some yeast on your tongue. And women, if you're getting recurrent yeast infections, then it could be because of your partner's oral health. You could be having some bacteria, or she could be having some bacteria in her mouth or yeast in her mouth that's causing you to get recurrent infections. Then you want your partner to swallow, but guess what? If your semen tastes horrible, you can expect for it to stay down. She's going to regurgitate it.
Sir, drink some alkaline water, do some push-ups, stop eating meat all the time, preferably coconut water. We don't want to have that discussion. I talk about that on my show. Listen, I know before my phone died, I want you to get the contact information because we getting real raunchy, but it needs to be happening. Whether you joke your way through it, we need to learn about it, especially in the black community. Tell them how to get in contact with you before my arm fall off because I ain't got my gimbal.
All right, at Dr. Katina, at DrKatina_DRK. Follow me for all your health and fitness tips.
You got a whole audience. This is the most professional ghetto situation I've ever been in. I am civilized. I'm civilized. But man, thank you again, man. That was dope, man. For a little quick one, I don't want to lose no files.